Since the 1970s, the number of children who are obese has tripled. Just astounding. My next guest, Dr. Deanna Aftab-Guy with TriStar Pediatrics, who's an endocrinologist, is going to discuss this with us. Good to have you on.
Thanks for having me.
I know you were on one of the first Community Health Matters, so glad you came back.
Great.
All right, let's talk about this. It continues to be an epidemic in this country. Why is that? Why is it still such a problem with our kids?
Well, we're seeing more and more of it, but I think that folks are actually trying to do something about it now. Obesity is a problem, but rather a symptom of other things that might be going on, and I think that it's heavily a strong influence is our genetics. And so if we have parents that are overweight from various inherited disorders as well as lifestyle choices, then their children are at higher risk. And so in our country we are seeing an increased risk, but there are several contributors.
Well, let's talk about some of those contributors again. So some of it is in the genes, unfortunately.
Sure.
But you can turn that around, but it's a lot of work, right? I mean, it's changing your behavior.
Right. And I talk with my kids about this. You know, we're trying to fight our genes, and you can't change that completely, but we can affect the things that influence how our body responds to our unfair genetics. And so we address the diet, number one. We address their body's activity level. What are they doing to move their body? And lifestyle in general, as well as addressing medications and evaluating them with a physical exam and laboratory assessment to see if there are other things that are contributing to their difficulty in maintaining a healthy weight.
So how can a parent tell when a child needs to see someone like you, a pediatric endocrinologist, that's a mouthful, and when there might be a hormone issue?
Well, number one important factor is to see your pediatrician. The child should have a primary care physician that they see regularly. We take our baby to the doctor every few months for vaccinations, but once a child reaches a certain age where the vaccinations are pretty much set and they start going to school, they tend to go once a year, maybe every few years, and they lose touch with their pediatrician. And we're starting to see increased obesity in children at younger and younger ages. If they are weighed and measured at their pediatrician's office each time that they're visited, and they talk with their pediatrician about all aspects of their child's health, including their growth, height, and weight, the pediatricians are very keen on this, and they will determine if the child truly needs just some simple interventions or an evaluation, or to be referred to a center that has several folks involved in a team that addresses these issues.
How is treating a child for obesity or one of these related conditions related to the obesity, how is it different than treating an adult?
Well, it's a good question. We have a team that addresses the dietary needs. We have a medical nutrition therapist and we have a physician, but we also talk about activity level. I think when an adult goes to their physician, a lot of times they don't always have available a nutritionist or dietitian, and that tends to have to be referred to separately. Also, the adult providers don't always have as much time to be able to focus on those issues. I think when you get to a subspecialist and the appointment's centered around that weight management, we tend to really jump on it as a team. So we do a thorough history, and I set up a separate consultation with our nutritionist, and my patients spend up to an hour and a half, sometimes 2 hours with our nutritionist. And I always tell them, I don't care what medicines I give you or how much time I spend with you, the reason why that child achieves a healthy weight eventually is because of my nutritionist. They're amazing. I think that they meet the family right where they are. We're not going to put them on a kale diet, as I tell them. They're families that have limitations based on financial needs or dietary preferences or allergies or what the rest of the family is going to allow to be brought into the home. And our nutritionists are excellent at hearing what they're able to do and tweaking it so that it can be healthier and benefit that child's health.
That's a good chunk of time, too, to spend with a nutritionist. I mean, you can pack a lot of information in that amount of time. That's wonderful. What are some of the health risks associated with childhood obesity?
Things that we know as adults at being overweight. Children are at risk of developing diabetes at younger and younger ages. Type 2 diabetes we're seeing at younger ages. They can have heart disease, elevated cholesterol that can lead to further heart disease, and then later on in life, strokes, joint problems, just overall inactivity because their weight and not feeling well.
And that's heartbreaking when you realize that had something been done when they were younger, someone intervened, nutritionists and someone to coach them on better choices and things, or if there is a hormone-related problem to get to that. Help us understand the difference too between type 1 and type 2 diabetes in kids, and what are some of the symptoms?
So diabetes is elevated blood sugar. Type 1 used to be called juvenile onset, and that is when our pancreas, the part of our body that makes insulin, that stores the sugar for us for a fuel, the pancreas stops making that insulin entirely. It's an autoimmune disease, meaning our body attacks that part of the pancreas and makes the insulin, and without insulin the blood sugar rises and cannot get into the cells. It's typically inherited, although you can get type 1 diabetes without any family history of it, and it's treated with insulin. These are the children that we know of that have to check their blood sugar and take shots and be managed carefully. Type 2 diabetes we used to think of in our grandparents and adults, and they still make insulin, and it's not an autoimmune process, but rather the receptor for the insulin is resistant, and it can be exacerbated and worsened by rapid weight gain. So you tend to inherit a tendency to develop it. You have to be that person that tends to needs to eat better and be more active, and you make too much insulin but don't manage your sugar well with it.
Okay, thank you so much for your time, Dr. Guy. Thank you for watching Community Health Matters. Learn more ways to improve your health on our website, mycommunityhealthmatters.org. And remember, here in Middle Tennessee, our community health matters.